Mayo from the University of Waikato, and I'm going to cover a few of the projects that I'm working on with students at the moment. So my main research area is AI applied to sort of medical data. That's what I'm spending most of my time with, and I've got some other students that I'm supervising or co-supervising that have got posters out there. So rather than talk about those, I'm going to talk about some of the other projects that are by people that couldn't make it here, so they haven't got a poster. So the first one here is to do with a device called a continuous glucose monitor, which is quite a new technology used by type 1 diabetic patients, right? And it's a new type of, the technology is a new type of treatment because what it allows patients and medical people to do is acquire a lot more data about how well patients' glucose levels are, which is the main thing they're trying to control if you've got diabetes. So I've just borrowed a picture here showing how such a system works. Someone wears the small sensor that they put on their abdomen in this photo. It could be on the arm also. And then there's a microcontroller and there's an insulin pump. So the system works together, and the idea is that the sensor reads the glucose levels, talks to the microcontroller, and then the controller adjusts the amount of insulin they're getting, sort of in real time. This is quite different to how traditional treatment is given to a patient, where they use a finger stick and take, say, 3 or 4 readings a day, and that's all. With this type of technology, we can get data every few minutes, 5 minutes is typical, and so we can do a lot more with it. And so I've just listed there a couple of the research projects that we've been working on. The first one is using machine learning to forecast glucose levels, so it's usually short term because there's quite a lot of noise in the long term. So there's quite a bit of work that's been done in that area, and I guess the holy grail there is the second bullet point, which is finding real-time insulin calculators. So given all of the difference in physiologies between patients, can we come up with some kind of rule that calculates the correct insulin dose all the time? Second one is completely different, so I put some nice pictures there for you to look at. This involves looking at cataract surgery videos. So it turns out that if you go and have cataract surgery, the doctor or the surgeon will have a microscope to monitor the operation, and they record everything that happens. So every surgery is about 15 to 20 minutes long, and it gets recorded and stored somewhere. And I'm working with a master's student and someone from the DHB to look at these videos with the aim of, well, there's many things we want to do, but one of the aims is to come up with a way of analyzing them using machine learning. And our initial application is to find outlier videos for helping with surgeon training. And the reason we want to do that is because if you want to teach someone to be a surgeon, then it's good to be able to show them examples of cases where surgeries have gone wrong. And since there's 10,000 surgeries that occur in New Zealand every year, the potential number of videos is very huge, so we'd like to automatically analyze the videos. And I've put a few screenshots there of some of the pre-processing that happens that my master's student's working on, so he's looking at these a lot. The last topic here is something that we're just starting on, and this is looking at images that come from a device called an in vivo confocal microscope, or a corneal confocal microscope. This is a machine that you sit at and put your eyes up to, and it will take very, very small images from the cornea. So there's a couple of images there. They're about 400 by 400 micrometers in size, so very, very tiny. And there's a very large number that are taken. So we get, if someone sits in front of one of these machines for a few minutes, we get hundreds of images. And in order to process these images, we'd like to sort of do some automatic stuff. Currently, most of these images are manually processed. So a doctor will sit down, look at the images, select the, say, 5 or 6 relevant ones out of several hundred, and then analyze those in detail. So can we provide some AI tools to sort of speed this process up and get rid of some of the poor quality images, maybe do some of the tasks that the doctors are interested in, such as sort of measuring the length of nerves and the level of branching, which can be used for diagnosing disease. So I've got 3 seconds left, so thank you very much. That's me.